Problems with the electrical system of the heart can cause rhythm problems in children, sometimes brought on by exercise. Should parents have their children screened for these heart abnormalities before participating in sports? We got some answers from cardiologist Dr. Ramin Manshadi.
Sudden cardiac death, basically what happens is that these young children suddenly collapse and they die within 1 hour of their collapse, and secondarily due to cardiovascular event. When we talk about sudden cardiac death in children, we're talking about individuals dying and passing and collapsing in athletic activities. These individuals that are harboring some kind of a cardiac condition, not congenital heart disease, but there are disease states out there that does not manifest itself until later in age. And for example, the most common cause in the United States is hypertrophic cardiomyopathy, when the septum of the heart, the muscle, is thickened in excess of what it's supposed to be. How often have you heard a star athlete, young kid, throws the last basket and he's very emotional and suddenly he collapses? And if you do not have an AED in place, automatic external defibrillator, then they can suddenly die instantly. And however, because they're young and they're healthy, if you do apply the AED or automatic external defibrillator, the chance of survival is upward of 90%. If you do not, then the survival is less than 5%. So these children are harboring some kind of cardiac condition that goes undetected throughout their lives. So it is very important that for parents, for educators, for coaches, to be aware and raise awareness of these conditions that exist and understand the warning signs, such as if the child is complaining of having chest pains when they're exercising, or if they're having lightheadedness, or they're feeling like they're going to collapse, or they are short of breath more often than usual, then one needs to be more precise in trying to figure out exactly what's causing this and doing the right history and physical. We have to look at the whole picture. That's why an EKG will be beneficial, because we can detect long QT syndrome, for example. There's another diagnosis called arrhythmogenic RV dysplasia. What happens is these children are born with the muscle on the right heart, it never develops, and instead we have fatty infiltrates build up within the muscle. So when that happens, it predisposes these young children to arrhythmias, which basically is a chaotic electrical activity that once it becomes bombarded and starts having this chaotic electrical activity, the heart does not function well, and the heart as a pump basically fails. If they have these cardiac conditions, they should not play athletic as far as competitive sports are involved, because they are very high risk of sudden death. Whenever any child is going to start any sporting activity, to visit a professional that is well versed in this kind of sports medicine. It is important to basically to take the overall picture and do the right testing, and we can actually help reduce the incidence of sudden cardiac death in young children.